All of the following are signs of dehydration except progressive metabolic acidosis, urinary specific gravity more than 1.010, urinary osmolarity less than 300 milliosmol per kg, urine sodium less than 10 milliequivalent per liter. The correct answer is C. When dehydrated, patient with normal renal function will retain sodium and produces a concentrated urine. Urine osmolality is typically greater than 450 milliosmol per kg in this setting. Urine sodium will be low and specific gravity will be high. Regarding central venous pressure monitoring, A. Low value of less than 5 mm per kg may be considered normal in the absence of other signs of hypovolemia. B. CVP reading can be interpreted independently of the clinical setting. C. CVP monitoring is never indicated in patient with normal cardiac and the pulmonary function. D. In a patient with right ventricular dysfunction, a CVP of 10 mm per kg should be considered elevated. The correct answer is A. CVP measurement must be evaluated in context of the clinical setting. Factors such as underlying cardiopulmonary disease, patient positioning, and anatomy can affect the values. A CVP of less than 5 mm per kg can be normal in a healthy patient without sign of hypovolemia. For surgical cases during which large fluid shifts are expected, placement of a CVP monitor may be indicated. Patients with compromised right ventricular function generally have a high CVP. Thus, a CVP of 10 mm per kg should be considered normal to low depending on the degree of dysfunction. In healthy patients, the lactate in the Ringer lactate solution A. causes a lactic acidosis, B. is converted to bicarbonate by the liver, C. is rapidly bound by albumin, D. causes a hyperchloremic metabolic acidosis. The correct answer is B. In healthy patient, the lactate in the Ringer lactate solution is rapidly converted to bicarbonate by the liver and does not causes a lactic acidosis. Administration of a large volume of normal saline can cause a hyperchloremic metabolic acidosis. Lactate is not bound by albumin. All of the following statements regarding the dextran solution are true except dextran 40 may improve blood flow through the microcirculation. Dextran may have antiplatelet effect. Large volume infusion of dextran have been associated with renal failure. Dextran 40 is a better volume expander than the dextran 70. The correct answer is D. While dextran 40 has a molecular weight of 40,000 and dextran 70 has a molecular weight of 70,000. And therefore, as dextran 70 breaks down slowly, it remains inside the intravascular space for a longer period. Thus, the volume expansion by this is more than the dextran 40. Dextran 40 appears to improve blood flow through the microcirculation, and all dextrans may have antiplatelet effect. Infusion of large volume of dextran, more than 20 ml per kg per day, has been associated with the renal failure. All of the following solution contains potassium except lactate Ringer solution, plasmalite, Hespan, packed red blood cells. The correct answer is C. Hespan is a colloid containing starch and saline. All of the other options that mentioned here contains potassium. Many patients with hyperkalemia, including patient with renal failure, routinely receives normal saline because it contains no potassium. The storage time for packed red blood cells at temperature of 1 to 6 degrees centigrade is 7 to 10 days, 21 to 35 days, 60 to 80 days, and 120 days. The correct answer is B. The storage time is 21 to 35 days, depending on the storage medium. Changes that occur in the blood during storage reflect the length of the storage and the type of preservative used. The most common non-hemolytic reactions to transfusion of blood product is allergic, febrile, anaphylactoid, and urticarial? The answer is B. Febrile reactions are the most common adverse non-hemolytic reaction and occur with 0.5 to 1% of transfusions. The most likely cause is an interaction between the recipient's antibodies and the antigen present on the leukocyte of the donor. The patient's temperature rapidly increases above 38 degrees centigrade, and the condition is treated by slowing the infusion and administering antipyretics. Severe febrile reactions accompanied by chills and shivering may require discontinuation of the blood transfusion. The estimated maintenance fluid requirement of a 9 years old 35 kg patient is 50 ml per hour, 75 ml per hour, 100 ml per hour, or 20 ml per hour. The answer is B. According to the 4-to-1 rule, 70 ml per hour would be the maintenance rate. This is calculated as the weight up to the first 10 kg is 4 ml per kg per hour. For the weight of the patient 11 to 20 kg, that means for the next 10 kgs, the fluid will be added 2 ml per kg per hour, and the weight of the patient above the 20 kg will add further 1 ml per kg per hour. Here in the question, the patient's weight is 35 kg. So for the first 10 kg, there would be 4 ml per kg per hour. So 4 into 10, that means the 40 ml. For the next 10 kgs, that means the body weight from 11 to 20 kg, the fluid will be added 2 ml per kg per hour. So that would be 2 into 10, the 20 ml. As the patient's weight is 35 kg, so 35 minus 20, so 15 kg. For 15 kg, there will be addition of 1 ml per kg per hour, 15 ml per hour. So if we add all this, for the first 10 kgs, there is 40 ml, next 10 kgs is 20 ml, and the body weight above the 20 kg is 15. So that will add 15 ml per hour. So total will be 40 plus 20 plus 15, that is 75 ml per hour. Bacterial infection due to contaminated blood product is the most likely with the transfusion of packed red blood cells, fresh frozen plasma, platelets, cryoprecipitate. The answer is C. One of the leading cause of transfusion related fatalities is bacterial contamination, which is most likely to occur in the platelet concentrates. Platelet related sepsis can be fatal and occurs as frequently as 1 in 5,000 transfusions. Platelets are stored at 20 to 40 degrees centigrade, which is probably accounts for the greater risk of bacterial growth than the other blood products, which are usually stored at the 4 degrees centigrade. Any patient in whom a fever develops within 6 hours of receiving platelet concentrates should be considered to be probably manifesting platelet-induced sepsis, and empirical antibiotic therapy should be instituted. After blood is collected, the preservative CPDA1 is commonly added. This contains all of the following except citrate, phosphate, dextrose, potassium. The correct answer is D. CPDA1 is the most commonly added preservative added to blood products. CPDA1 means citrate, phosphate, dextrose, and adenine. Citrate as an anticoagulant, phosphate as a buffer, dextrose as a red blood cell energy source, and adenine needed for the maintenance of red cell ATP level. The potassium found in the blood comes from the breakdown of the red blood cells.